Losing your hair is no fun. I think most men will agree with me here. But would you be willing to sacrifice your potency for retaining your hair? Finasteride could confront you with just this kind of trade-off. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. In this video, I will discuss the post-finasteride syndrome. Finasteride is a drug for treating hair loss and benign enlargement of the prostate. Reports of sexual dysfunction, even long after people have stopped taking the drug, have made the headlines. But is post-finasteride syndrome for real? We'll get to that in a minute. If you like my content, subscribe, leave a thumbs up, or support the channel by becoming an above-average member. First things first, finasteride is a safe drug. For myself, I don't prescribe it, I'm more of a dutasteride guy. So, what does it do? It neutralizes testosterone. Kind of. However, don't be afraid, you won't become a woman if you take it. Testosterone is mostly a precursor hormone. To unfold its magic in the body, it has to be refined first. The process results in an even more powerful hormone by the name of dihydrotestosterone. The prostate loves it. The prostate needs it to work properly. But the prostate also is a potential troublemaker because it starts to grow in most men during the second half of life. This is not a swelling. It is real multiplication of cells. Finasteride makes the prostate smaller again because it robs it of dihydrotestosterone. The prostate runs out of gas and cells in the enlarged area start to wither away. Hair roots also interact with dihydrotestosterone. Here it causes premature aging of the hair follicle. The hair will fall out much sooner, but there is an end to hair regrowth. You don't have endless replacement cycles. The good thing is, finasteride also promotes hair regrowth. However, a few years back, reports from patients emerged about sexual side effects. Young and healthy men complained of mostly erectile dysfunction. And even after ceasing the drug, erectile problems would continue. Sometimes they continued for a long time. Even 10 years and longer seems to be possible. This has happened in relatively few men though. The condition is so infrequent, I don't see these patients at all in my practice. Furthermore, there is still controversy about the nature of these problems. Is post-finasteride syndrome for real? Is it really a side effect of the drug? So far, science has not been able to dispel all doubts. Nevertheless, regulatory agencies in several countries issued warnings, among them the FDA, but also German authorities warned as early as in 2018. Prostatic enlargement can be a real burden to quality of life. In these patients, the benefits clearly outweigh the risks, but hair loss in men, I counsel my patients against the drug if they ask me. Recently, another warning has been issued. This time, it is about depression and suicide ideation. Even here, we are lacking a clear scientific connection, but still, uncertainty remains. Here's a list of possible symptoms that have been associated with finasteride. The question is there anything anyone can do? Yes, it is always possible to try Cialis and Viagra, but since we don't know what really happened, it will be hard to treat it. This year, a scientific article has been published about post-finasteride syndrome and trazodone. Now, trazodone is a very old antidepressant. It was discovered in the 60s and is licensed in many countries. Already in 1998, an article in the Journal of the German National Society of Urology points out the pro-sexual effects of this drug. It enhances potency, and it enhances sexual desire. This year's article argues that these two properties could revert possible changes of finasteride in the brain or within the periphery. We don't really know for sure where they occur. Since trazodone has been around for a long time, data on safety are numerous. It has few side effects. However, in rare cases, it can cause priapism. If you want to know what this is, here's a video about it. Finally, it is very cheap. For sexual issues, it only takes a few hours to days to take effect, and this occurs at low doses, much lower than necessary for depression. But the drug has not been licensed for this purpose, and there is a catch. It seems no one has tried it against post-finasteride syndrome yet, but I think the idea and proposed mechanism of action sound intriguing. Thanks for watching. Bye-bye.